young lady here. And we're really, this first
Okay,
thing
I
I'm
will
going to
send,
do is
if you
just,
have email, I will
I'm
send
really just
for,
going to do her
yeah,
forearm. I
I'll
will do a
email
little bit
for
of the shoulder just so you can see in this position how to do it. And I realized the other day I must have been talking and not using my hands afterwards, and so my whole shirt like got that greasy, yucky stuff on it. So just make sure you wash your hands after you're done, so you don't ruin your clothes either. And with her, I'm going to use 2 towels because I don't like this on her top. So I could have used 1 long towel. I just find that the long ones sometimes are just more cumbersome to deal with in a small area. Okay, so now you're comfortable? You need me to raise that up a little bit for you.
I'm comfortable.
Are you sure? Were you a believer?
No.
What do you think? We're going to try both. She's going to tell me if that's better. Oh, that's not good, right? You just tell me when. Right there? Okay, I'm going to go just a little bit. So we don't want to go too high, because what happens when I go too high, especially if she has an impingement, you see how that just starts to not feel good, I don't think. And I'm sorry, my hands are so cold. I apologize. So I have my cream, and then actually, let's do this before we get all messy. Was the other stuff. Remember how we talked about the fascia free last week? So if you were going to just work on maybe a area that's bound down. So this just is a little bit, allows a little bit of friction, but it's not quite as goopy as that. Okay, so I'm going to take a little bit off. You're allergic to bees at all?
No.
Okay. So I've asked her all her things. I've checked her chart. I've checked her plan of care from the therapist. I've explained to her she's got a little tendonitis of her extensor carpi radialis longus. And so it's hurting her to do wrist extension type things, and she can't lift things. It's uncomfortable for her. So I'm going to try and break up that tissue a little bit. She's been going on now for over a month, so we're going to try and remember, restart the acute phase for her to get her to go back through another phase. So if I know that that muscle belly and the tendon comes up to the lateral epicondyle, and if you're not sure where something, origin insertion, I know you guys are just starting to work on that. That's why I brought the little card so you can look up whatever you're doing, and you can look at the origin and insertion and know which way the fibers are going. So if you're doing something that you're actually working them this way versus going to cross friction them. Okay? So it's up in here, and I just kind of, is it sore a little bit?
You guys will see us?
No, just tell me how it feels. It's good. So for her, she obviously doesn't really have a problem here. So if she had an inflammation, it would be sore. She would not like what I was doing. I'd have to explain to her that's normal. It's going to hurt while I'm doing this. As I do it, it starts to feel better, okay? So remember, I'm doing that where I'm letting the skin come with me and I'm rolling it back and forth. I have good position for me. This is a little high for me as far as this goes, so I'm going to do what? Bring my stool up, right? So much better. And I noticed that after just like 2 seconds, I think Jen was telling me how the other day she was massaging people and then she realized how sore she was, that then it does start to make you be aware of what you need to be doing. So I'm just going to go back and forth. So this is a little bit of cream allows me to go into that area. And you will feel some normal redness afterwards. I'll have like a red spot in there, okay? Now if I thought, that, well, I did that cross-section, but she's still really tight in here. So I'm going to kind of just work. So you have an interosseous right here. And that's just kind of the separation of those 2 muscle bellies of your extensors. So your extensors are on this side of your forearm, right? And your flexors are on the other side when you're in the anatomical position. So this would be one technique. So, okay, so I started with my effleurage, right? I just kind of got her used to it, bringing it up. It's a smaller area, so I might just do this and just do one side effleurage, okay? Kind of awkward to do 2. Or I could use my thumbs. And then I'm just kind of bringing her down. How's that feel?
Good.
And I go across her elbow joint and across her wrist, okay? So I'm coming up and down. And then my pressure's not very far right now. When I was doing this, I felt some tight spots. So then I start stopping and then I get a little deeper and I dig in there a little bit. So then I'm going to try and start doing a little petrissage. So I'm going to pick up that skin. I'm going to bring it around. And again, on most of these, you're going to be working towards the heart. And then I might turn her this way and just kind of work the muscle belly. Her supinators and her pronators, all those things that kind of get tight and sore. And then I might come around here and just kind of feel, and then I might open her hand. I don't know how many of you have ever had a manicure. If you're a guy, I recommend it because this part of it is the best. I didn't get my first one until I was like 40. It was a gift from somebody, and man, this is the life. And I think my daughter's probably had, as many as I've had in my whole lifetime in 1 year, maybe. And you can kind of do some nice relaxation afterwards. Okay. So this is just basically effleurage, petrissage, and then ending with the effleurage again. She's supported. It's a nice position for her. She feels fairly comfortable. I could get deep in there and do some ringing. As far as that other petrissage one that we talked about, that's a lot of times those people have a lot of tension in here. That's a really nice one. I could do that. What do we call this one? Indirect myofascial release, right? Or I could do this, bringing them together. I could do the cross hand one, but really not a purpose of doing that in this one because it's not a very big area, so I'm much better to just do it like this. If I found a little trigger point, I don't usually do a J-stroke here. I might do a little direct pressure on somebody and just hold it in there, kind of gather up that tissue, find that trigger point, and just kind of hold it. Okay. Really important for you guys to protect your wrist. Do we do it, are we in a flex position, an extended position, or a neutral position when we're doing our massage? Neutral. So as much as possible, and you can adjust the height of wherever you're at to get those that way. Same with your fingertips and all those. Just protect them. Try not to hyperextend them when you're doing your stuff. Use your shoulders as best as possible so that you don't have to use the smaller muscles here, that you're using your bigger proximal muscles and your legs when you're doing things. Okay? So that's that. Any questions? Just back to our little lecture that we trap when she goes to lift. So because her rotator cuff muscles are still weak, she's tending to use her elevators of her shoulder here. So I know how you'll see those patients sometimes that kind of lift like this. And so then this muscle goes into a lot of spasm because it works more than it's supposed to work. So this might be a common area that you're going to treat them. I preferably would do this either supine or prone with them, but we'll just show you how you can do this in sitting. Okay? So I'm going to effleurage her. Kind of get her used to my hands. And now you can see why. And I am a stickler to, like if I have a patient, they can have their sports bra on, but that's about, I cover them up with a gown. But if they have all kinds of clothes, you can't really do a very efficient job soft tissue massage-wise with a bunch of clothes on. So I envy Bess because her patients get to just disrobe and you don't have to deal with any of that. So you just have to feel comfortable enough, have them feel comfortable enough, drape them appropriately enough so that, like you can see, I have to kind of stop and I have to fuss around with this, and so I can't do as good a job. Now, if I have her lying on the table with a gown on, I can kind of move this stuff out of the way a little bit. I might even have her take that one side down a little bit on as far as her gown and just cover her so that I can get that whole area without having to be interrupted and not be able to be smooth. Okay, so there's two ways I can come from behind and just do one. Okay, so I'm just kind of doing a little effleurage with her. Or probably an ideal way would be to come this way. Okay, and use my body. And this is just not very comfortable to me, Somebody else maybe, but don't you just feel like I'm like on top of you almost? It just seems, it doesn't seem very relaxing for my patient. But you could do that. You got your petrissage going on. And then if I were to come back here, and I'm kind of trying to maintain my things, I would just, here's when I start doing my petrissage. Okay, how's that pressure? Is that
Too
okay?
light.
Too light. She wants more, and that's good. That's what you want. You want that feedback. So she's like, man, I'm sore in here. Give me some oomph. And then you can feel. She's got a little area here that it's kind of popping underneath me. And you feel that trigger. So this is where she would really like me to dig. Are you okay?
So it just feels more firm at that point?
You'll feel it pop over. Actually, it'll just actually pop over your thumb when somebody's got a trigger point. So you can probably try that on Rebecca. We'll see if she has one on both sides. Yeah. And all this sitting and steadying. And so then, after I would do the soft tissue mobilization with her, I'm doing my little picking up petrissage, okay? She might be one where you would do that direct pressure. You guys remember where the fibers, so like the levator comes down this way? I don't know if you guys have done those yet. Your upper trap's more this way. Okay, your deltoids this way, biceps, tricep, okay? So that you start thinking about where those fibers go. Your middle trap, your rhomboids are going this way. Your lower traps are kind of going more down, okay? So we just kind of work on all those, pick up her skin, and then we'll put her prone.
So this is better to do prone than sitting?
It's not necessarily better, they're just different options. And sometimes you have a patient who's a post-op that cannot lay down yet. It's really uncomfortable for them, so this is what you do. I would just say I would get rid of the tank top part and have this open. I'd probably have her take her bra, put a gown on, so that this whole area is exposed. But for class, you guys have to keep your sports bras on, so there you go. So we just do what we can. And so then I would just come underneath, and work on those muscles. Kind of start doing my little effleurage, and then I do my petrissage. Kind of work those muscles. How's that feel?
Good.
And don't always get to ask them how they feel. And then after I got done with that, because I would notice that she was having these issues, then I would work on her posture. Kind of we were talking about those techniques to work on her scapular retraction. Okay?
So if she
Adduction.
was having a problem with one shoulder, you would also do the other?
I don't necessarily always do the other side, but I will feel both sides and see. In treatment time, you unfortunately don't have time to usually do both sides unless there's a compensation. So in the real world, you pretty much treat the side that they come in for just for insurance purposes. But like me, when I'm working on them, it doesn't take any more for me to sit here and do this and just kind of feel it. But then you also don't want your patient to expect that as well, so you have to be really careful if their plan of care from their physical therapist says left shoulder only, and then you do both, and then the therapist goes in and sees them and says, oh, well, the Erin did both sides for me, it felt so well. Might not be recepted too well. So you have to just, use your judgment on those cases, yeah, and that kind of thing. Okay? Any questions on any of those? Pretty self-forward, you're just gonna their upper traps, their levator, and their bicep and their deltoid. So now you're not gonna have time to do all of those, so you pick which one of those you would like. And so what we should have done is tied her up before she got on here so she wouldn't feel so exposed. So that would have been a better thing to do, but she's just ready. Okay, so I'm going to raise this up now. Do you want a pillow for your belly?
No.
No? So I'm just going to put one under her legs. And then I'm going to give her a nice little pillowcase for her face. She got on there before I was ready. I was gabbing. And the pillowcase is just a little nicer. I think you guys have found that the others are a little rough on your face, and you come up with a little kind of raccoon face. So if you don't like that, just use a pillowcase. And we're just going to kind of put a little towel there. Is that okay? Do you prefer it without or with?
With.
Okay. And is that enough? Or do you need more? She
I
needs
could use
more.
another.
So can you guys give me just 2 regular towels? Oh, here they are, right here. Let's see. I'm gonna need these. Yeah, I'm gonna need those, Zena. 2 big ones, yeah. Thank you. So of course I would have had this all ready ahead of time for her. And it's better to spend the time positioning them, even though it takes a little bit of time. Good enough? You sure? Okay. Let's try this side. How's that? Good. Good. Okay. So now we're going to, is it okay if I take your gown down here a little bit? So we're going to do her left shoulder. And so I'm going to just, again, I'm going to drape you here and expose that area as best I can. Okay, so now I have this all nice and exposed for me. I can see her levator that comes this way, her upper trap that comes this way, her middle traps and her rhomboids, her infraspinatus. All her muscles are pretty exposed. I even could do a little bit with her deltoid if I wanted to, okay? And I might just even take this arm out if she didn't have, if she had good motion, or have her do it ahead of time, and then just kind of bring that down and drape it. So now everything's out. Is that okay? And then just to make her feel comfortable, not to feel cold, I just kind of do this to warm her up. Okay, and I'm going to move her shoes. Good body mechanics. And so I'm going to start with my effleurage. I have my cream, whichever one you prefer. Okay. I'm going to touch you now, okay? It's going to be a little bit cold. Hold on, I think my hands are fairly warm now. So I'm going to start with just some effleurage. And you can see, Rebecca can kind of probably tell you, with this cream, I'm a little hesitant, so it's probably not as smooth for her. So I'm going to give you just a little bit of that on there. Because we're doing a bigger area. So that's better, huh? Yeah. So you can see the friction's less. So when you're doing a larger body area, you need enough lubricant to help you out. Okay? So I'm doing my effleurage. Kind of just come down. Just kind of come in here. Work those muscles a little bit. Okay. And then after I feel things, and you can see with her, she's got a little winging here, so that means we would do some strengthening of her serratus, her rhomboids, all those, to just kind of work on that. And that's why posture-wise it's a little uncomfortable for her, and why she gets those things. So when you're doing this, you're evaluating all that. You're kind of looking, and as you get more experience, those certain things will just stick out to you. And then if you're not sure what they indicate, you can talk with your therapist and say, oh, well, I noticed that so-and-so had this, and then you can talk about how you guys can correct that or help with that. And then I got my petrissage, picking up the skin. It's a really nice area to do this. Sometimes I come more from this area, okay? I'll pick it up, bring it off. I might do what we call a little bit of a release here. So this would be a myofascial release. I'm holding right here. I'm bringing her down. How's that feel?
Feels good.
Good.
That's nice because you can't do that one from sitting position.
Exactly right. And you'll be able to do this also in supine. Okay, so just so I don't take up all your time, so there's a couple options. You can practice the finger roll, see how much more finger roll you'll get. Okay. You can find out if there's areas of tightness. You could gather the skin and do your J-stroke, like she's got that trigger point right there. And so you could really work on gathering that and kind of just holding it. You can tell her to take some nice deep breaths for me. Take a deep breath and breathe out. And when she breathes out, that's when you can kind of bring your finger in there a little bit more. Okay? You can take a deep breath for me and relax. Nice. Okay? And then I end with what? Effleurage. And I ask her how she did. You doing okay?
Yeah.
Good. Okay. So there would be prone. Okay. And we could have probably put this down a little bit more. I think her head was a little bit, and I didn't really get to show her that. And when we get to the spine, we'll kind of talk about this area in here and how you guys can massage that. But for today, we'll just focus on the upper extremity, okay? So now I'm going to lower you down, Rebecca.
For the J-stroke, how long do you hold the
Until I feel a release. Yeah, and sometimes I don't feel a release,
So just release.
So then you have to just start over because you don't want to kill them. And you don't want to do that for too long. A couple minutes is about all they can tolerate. Okay, now I took you out of your gown, so I'm going to tie her up before she gets up. Maybe. Up. There it is. Gown's are like 5 sizes too big for her. Maybe this guy, like that, without killing herself there. There you go. Is that good? And then, of course, I'm putting a pillow in between her legs. Okay. Got all these towels, more than we need. So there's 2 things I can do here. Just for time's sake, pretend like I draped her, okay, you guys? I just want to give you guys time. So she's draped, everything's good. I'm here in front. I can go all the way from her tricep, bicep, deltoid. You can come all the way up here, and this is a really nice position for this muscle because you're supporting it. You have total exposure to it. It's a really nice way to get your bicep, tricep, and your deltoid. Okay. You get your effleurage, so you're wringing or you're pinching. Then I can go up, and then I can start working on her trap. Devator. I can kind of get all those in. How's that feel? Which position do you like better? She says, I don't care. Just keep massaging. What do you think? Yeah. Prone. Yeah. A little more relaxed, right? Yeah. And you can really relax in that position because you really aren't, you don't have any visual, you know, here she has to look at me. Blah, blah, blah. Yeah. Okay. And then what we'll learn down the road, too, is once you get done with that soft tissue massage, great position to be in to kind of start working on her scapula, working on loosening that up. Then I could end it with some P&F kind of patterns for her to kind of work on that posture. So then she hasn't had to get into anything but one position. So sometimes if you have a post-op and you know they're in a lot of pain and position changes is a huge issue, this may be your position of choice just because you can do 3 or 4 of your treatments in this position, and then you just have to get her up to do her ice or her stim or whatever you're going to do at the end of your treatment. Okay? Okay, so now let's go supine. Give her her pillow. And I usually always, somebody want to grab me a blue bolster? We have these in most clinics, so I use them when I can. There are a few people who prefer a pillow, but I think the bolster really just takes a lot less stress off your spine. So if you have it, it's cold, so let's go ahead and, is that going to be too cold on you? So I normally would do this, though. I would have this on there for her. For hygiene's sake, right? For infection reasons, so you don't have to clean that guy off.
I think I've been using it the wrong way. So we should go that way.
Oh, well, no, it really depends
Yeah?
on what you're doing. So like right now, this is just to lower the stress on her low back, so I'm glad you mentioned that. So if I was going to work on swelling, though, this kind of puts her, it puts her in the wrong way, right? So for swelling, you really would want her like this, elevated. Okay, so it depends on your purpose. So great question. More than one way. And then you're going to have those patients, this is too high, it's not high enough, you need to add a pillow depending on what they have going on with their spine. So just know that, you know, everybody's a little bit different, so you just have to look at them and make sure they're comfortable. You comfy? Yeah, okay. She looks comfortable, I believe her. So again, I would be draping her. 2 different ways I could be doing this. I could be sitting, or I can just be here, where I do my effleurage on her, okay? Oh, we lost my cleaning, huh?
Would you have like an aide helping you during this time?
No, not at all. No. No, if you would have everything ready, and you're only doing one spot and you're only doing one position, so you wouldn't be doing all this that I'm doing right now. You know, you'd already have figured it all out and you're all right there. Yeah. So here's her effleurage. Okay, and if I found some tight spots, I'd probably work on them. Do a little petrissage here. Coming up. I find that she's a little tight in her biceps, so then I'm kind of going to work that guy a little bit. I could do my release, where I get the whole arm. I could do it both ways. Okay, just kind of working it. Here I can get into her pecs now. A lot of times post-op shoulders, and this is where you want to be, you know, respectful, and you're going to let them know. So you would probably definitely start here and then work your way up. Now I'm going to work in this area here. And then I would kind of do my effleurage. Know where the pec minor comes here, okay, and the pec major. And so then again, I would be exposing that area as best I can. Do my effleurage. So I'm just working it. And then ending up at the end, okay? I could elevate her. She had some issues with swelling. Have her up here. She could be on me as long as I had a towel. So I don't ruin the second shirt. So she would be supported on me so she wouldn't have to be holding this, okay? And I can just kind of be pumping that down towards her heart, just like this. How's that feel? And then if I wanted to work that shoulder from here, that posterior shoulder, again I would have draped her. And I'm up here now. And now I'm working those traps. So I'm more like this. I would have her come up a little bit closer towards me this way, most likely. I'd have her relax her head. And now we're going to be able to get right in there really nicely. And I can figure those trigger points out. I can work her suboccipitals that might be causing her headaches because of her pain in her shoulder. I can see her sternocleidomastoid here, her scalenes if there's issues with them. Okay? So just so you know, there's options. But right now, we're just going to work on shoulders. So you guys can pick extensors, flexors, deltoid, biceps, triceps, or the levator or the upper trap, okay? So do you prefer counting off, or do you prefer just having a partner? Doesn't matter? What's he doing over here, huh? Did he ask permission to come? So, do you guys don't care? Do you find that you guys are moving around and you're getting, so then I'm just going to let you guys do it. No more micromanaging, okay? If I see that people aren't aren't having new people, then I'll just count again. Because you do kind of get used to it. You have to just talk about it, have a fun weekend or whatever. So, that's totally fine. Comfy? Okay, any other questions, you guys?